Here at the Facial Rejuvenation Clinic, we have considerable expertise and a great deal of experience in treating all common skin cosmetic and appearance medicine conditions. We have all the available and latest and state-of-the-art modern laser equipment. We've got a vast knowledge of and experience in diagnosing and treating and managing with excellent customer service all of these conditions. Now, there are three main types of changes that happen to our facial skin especially. The first is what happens to the surface complexion of the skin. The second is what happens to the deepest areas of skin, which are changes with increasing age. And the third is the various techniques and treatments we've got to actually prevent and repair certain individual lines and creases. But when we look at what happens to our surface complexion, which is really the skin we look at, and that's what most people are concerned about initially, certainly when we're young, we're talking about conditions that affect really only the top 1 to 2% of our skin. And they're conditions that cause changes in the colour complexion of our skin, particularly brown pigment changes, which can be due to sun damage, can be due to just long-term exposure to normal ultraviolet radiation without adequate use of sunscreen, or they can be due to hormonal changes causing pigmentation. In Australia, we have a very high incidence of ultraviolet light. Even on a dull, rainy day like we've got today, ultraviolet light is very strong in the southern hemisphere, particularly Australia, penetrates through ultraviolet light and damages our skin by causing free radical damage. And we have many treatments to try and prevent and reverse that. Other changes that happen to the surface of our skin in terms of complexion is the pore structure of our skin, so the fineness of the surface of the skin. And again, we have many treatments for that. So when we look at the structure of our skin, if we take the skin of the cheek or anywhere in our face, it's got a certain thickness. So in a three-dimensional sense, we've got the surface layer, which is a completely independent layer to the deeper layers of our skin. We've got the oil gland layer, the structural collagen layer underneath, the muscles and the bones. Now our skin is constantly rejuvenating and replacing itself, so we get the surface layer, for instance, is very thin. It's 1 to 2% of the thickness of our skin. It's less than 1/5 of a millimetre in thickness, and it's completely replaced every year. A slightly different way of looking at our skin surface is to look here at the structure. And the skin surface, this layer here called the epidermis, that all of those, that cellular layer is replaced every month or so, and the cells grow from a stem cell area at the base here. Now, all of the issues to do with sun damage, pigmentation, redness, and a lot of the pore structure is just what happens in that very surface layer. Pores and fine lines can also be affected by what happens deeper, but the main complexion issues of colour change and also redness, facial veins, fine lines and pores are what happens on the surface. Now, it's probably the most complex and difficult and risky area to treat of the skin in inexperienced hands. Lasers are the mainstay of all our treatments, and lasers produce the best long-term and most significant improvement, but must be used very cautiously and carefully, because there's many factors that can increase the risk of using lasers, particularly the structure and type of skin, whether it's fine or thick, but most importantly the colour. So a dark-skinned person has to be treated much more carefully and lightly and gently and with a lot more experience than a lighter-skinned person. And once again, it requires a great deal of knowledge and understanding and experience and expertise in being able to treat these, and really understanding the laser modalities or even the peels and skincare product we use in treatments and we recommend for home care to maximise the improvement and minimise any damage that can be done to the skin. here at the Facial Rejuvenation Clinic, all our consultants have undergone significant training, have a great deal of many years of experience and expertise, and are constantly undergoing training to not only deliver excellent customer service but good quality medical care to ensure the best results for our skin. We also conduct laser courses regularly and constant laser training, and we're constantly updating to the latest available medical lasers. Because we have such a large range and comprehensive range of all the lasers, we'll only match the most appropriate lasers to the certain skin conditions. We have advanced medical cosmetic grade skin care, and essentially our advice in improving cosmetic appearance medicine on the complexion issues is essentially to use a long-term sunscreen, which is the mainstay of all treatment. Most people don't realise that most sunscreens have lost their effectiveness in 2 hours, and we've got long-acting sunscreens that last 8 hours, which every Australian should use every day. The second component of good skin care is to use the antioxidant vitamins, particularly vitamin A, B and C, which are protective, but they also reverse the free radical damage done by ultraviolet radiation, which all Australians are exposed to every day, even if they're indoors near glass at the office or home, or they're in a car or a bus or a train. If their face can see daylight, then daylight, which is that invisible ultraviolet radiation, is potentially damaging and aging their skin. So protection is important. The third component that's very important in skin care regime is a pigment inhibitor, which works on the pigment producing cells to regulate the regular and even production of pigment across our facial skin, so we have an even complexion without dark and light patches. So once again, here we're equipped to offer the best advice. Our cosmetic range of treatments, products is very comprehensive, and all our staff are constantly undergoing training to be able to offer the best skincare regime that's suitable for you. Moisturisers are over-prescribed and overused, and whereas they're nice to use and they have some benefit for the skin, the 3 products I've mentioned are the most important in that they have active ingredients that really do help to repair and prevent skin. And lasers are by far the most effective treatment. So as your skin is unique and individual to you, it's best that everyone comes for a complimentary, comprehensive consultation with one of our trained consultants to find out which treatments and which treatment protocols and regimes are best for them.